My name is Dr. Fadia Askar. Today the topic of my course is Rapid Crown Prep. By the end of this session, I will be expecting my audience to be able to identify the situations that require crown prep. They should be able to list the types of crown and describe the techniques used for crown prep. They should discuss the impression materials that has been used in crown prep and summarize the special considerations for the fixed prosthesis. I will be explaining in my course step-by-step procedure of the rapid crown prep. The first dentist who talked about rapid crown prep in 60 seconds was Umar Reed. According to him, if you can't conceive how a crown prep can be done in 60 seconds, it's probably because you have never used a high-speed handpiece that has high torque, or because you are not using a brand new burr every time, or maybe you are just using the wrong burr. Why to prefer rapid crown prep? If I say rapid crown prep, it doesn't mean that I'm fixing my type for the prep. It means I am actually giving less time to prevent the trauma to the pulp. I'm trying to maintain the health of the pulp. As rapid crown prep brings out bigger profit, less trauma to the tooth, and it improves productivity. As all the patients, when they come to a clinic, they prefer to have shorter appointments compared to the longer ones. So you should try to improve your productivity with speed that leads to excellence. To do this, I will start with first identifying the situations that require crown prep. Firstly, if there is extensive destruction of the tooth due to caries, then you have to go for the crown. If a patient comes with bruxism, clenching, there is a lot of tooth wearing, generalized tooth wearing, you have to give him the crown. If a tooth is endodontically treated, it becomes brittle. Therefore, it is compulsory for an endodontically treated tooth to have a crown. And at last, tooth wear. If there is a lot of tooth wearing in the tooth, then you have to give it a crown to secure the structure. Most of the patients, they want to improve the aesthetics. For that, they want the tooth to be crowned so that it turns out to be more pleasing. Fractured tooth mostly occurs in young adults, children. They also require crown as a replacement. Step-by-step crown prep procedure. It will be easier to understand the procedure of rapid crown prep if we look into each step separately. Firstly, we will start with the local anesthesia, then the pre-op impression, then we have to remove the existing restoration and restore it, then we have to prepare the crown and finish it, and at last with the final impression done, and then we have to fabricate a temporary crown and cement it. We are going to start with the local anesthesia. According to Umar Reed, we do not need to use topical, as it just warns the patient that they are about to stick them. It just takes an extra time, nothing else. If we have to give local anesthesia, firstly we should start by choosing the anesthetic agent, that is articaine. Then there is no need for the mandible blocks. We can use X-tips. They are very useful. Topical anesthesia can only be given to the patients who request it, and otherwise there is no need for topical anesthesia. You can directly go with infiltration. The local anesthetic agent that is been used for local anesthesia is articaine. It differs from other local anesthesia because the amide structure of articaine is similar to other local anesthetics, but its molecular structure differs through the presence of a thiophene ring instead of a benzene ring. Articaine is exceptional, but it contains an additional ester group that is metabolized by esterase in the blood and tissue. The elimination of articaine is exponential with a half-life of 20 minutes. Since articaine is hydrolyzed very quickly in the blood, the risk of systemic intoxication seems to be lower than with other anesthetics, especially if repeated injection is performed. Out of all anesthesia, prilocaine and articaine generates the signals of paresthesia, especially when it is used in dentistry. Articaine should not be used in inferior alveolar block, or should not be given palatally. Mandibular blocks. Mandibular blocks have a long wait before they take effect, and when they fail, you have to perform it all over again. Therefore, infiltration should be the first choice of method for pulpal and soft tissue anesthesia of mandibular permanent incisors in adults. Regional block injections are sometimes ineffective due to crossover innervation from the opposite side of the inferior alveolar nerve. It is recommended to deposit at least 0.5 ml of anesthesia on the buccal and lingual side of the inferior alveolar nerve. The use of infiltration anesthesia with 4% articaine in obtaining anesthesia of the mandibular permanent molar is getting common these days due to the successful formulation. Therefore, we have the alternates for mandibular block, like the periodontal infiltration, buccal, lingual, intraosseous infiltration. X-tips is getting common these days as it's an effective substitute for mandibular block. It has an immediate onset, and studies have shown 91% success rate. The first thing that we should start after giving infiltration anesthesia is isolation. Isolation is very important because it increases the accessibility and visibility of the tooth. It saves time and it provides a clean, dry operating field so that the doctor can work on it. It increases the operator's efficiency and it provides patient comfort and safety with a quick and easy to implement and provides airway protection. As here we can see the isolation that has been maintained for the procedures being going on. It can be used easily, and for the crown prep procedures, not only crown prep procedures, but it can also be used for the implant procedures, as it provides a clean and dry environment and it provides airway protection. It is very important to isolate so that one can prevent aspiration of any accidental breakage of burrs or parts of implants. Then we have to start with the pre-op impression. Pre-op impression the most commonly used material for it is adhesion type silicon and polyvinyl siloxane, call it PVS. These materials do not produce a volatile byproduct during polymerization, and therefore minimal dimensional changes occur during setting. And it has a short setting time, and its tear resistance is high. This pre-op impression for temporary has 90 seconds set. I prefer polyvinyl siloxane over Alginate since it can be safe for a longer period of time after the case is completed. And even if your patient comes again for replacing crown with zirconia, you already have a provisional impression to use. Now, before starting with preparing the surfaces of the tooth, we will remove any existing restoration that is present, and for that, the burr firstly that is used is 330 carbide burr. It helps to remove existing restoration. It removes the unsupported part of the enamel, removes caries. It has a very high efficiency. As we can see in the pictures, it has sharp blades and it wears longer. And most of all, it is inexpensive. Other burrs, yes, tungsten carbide round burr. It helps remove the remaining of the caries. It leaves the surface smooth, and as we need a variable speed to remove the caries, its speed is 200 to 300 RPM approximately. The purpose of using slow speed removal is that it does not generate heat, and therefore it won't irritate the bulb. If along with it you also use water irrigation, it will keep things calm. Finally, in order to remove any questionable part of caries that is present in the tooth, we use Smart Burr tool. It is also available in SS White, which is easily available, and it is used to remove the final caries. It won't harm the enamel or dentine, so it is very good to give a final touch to the removal of caries. And it also eliminates the risk of unintentional pulp exposure, as it targets only the carious part, not the enamel, as it does not hurt enamel. Therefore, after removal of the existing restoration, we need to restore it. To restore the restoration, we can use Fuji2 capsules that is very easy to use and handle, and it's time saving as it is very easy to dispense. It is a dual mixing, and even after mixing, it immediately hardens, so it cures just in 10 seconds. It is a very short curing time. Here we can see that once the decay is removed or a defective restoration, we can see a clean cavity in figure 2. And after we obtain a clean cavity, I most probably isolate the tooth and then do a core buildup of it. Here we can also see pictures before core prep and after the core prep, how the tooth has been cleaned, decay been removed, and post and core has been provided, and it also provides a foundation so that adequate retention and resistance form for crown can be achieved.